Hi, this is Tony Ward speaking, and I'm an Associate Professor of Counselling Psychology at the University of the West of England. And for quite a few years now, I've had an interest in the topic of integration, which is about how we can bring different ideas from different theoretical models of therapy together for the benefit of clients. So what I'm saying by that is that we might use person-centered ethos coupled with CBT techniques, perhaps trying to use insights from psychodynamic therapy, all in one set of sessions with one particular client. And one person who I know has also had an interest in this issue over the years about how we can bring different ideas together is Professor Mick Cooper, who will shortly be at the Roehampton University. Mick's joined me for a discussion of this today. So, Mick, would you like to say a few words just to introduce yourself?
Yeah, hi Tony. So I'm Professor. I'm going to be, from February, I'll be Professor of Counselling Psychology at University of Roehampton, and I've been involved in, I kind of come from a person-centered existential background, practicing counselling psychology, do a lot of work and research around working with young people. And I guess over the last 5 years or so, I've been involved working very closely with John McLeod and other people, including yourself to some extent, Wendy Dryden, Biljana Van Ryn, to develop a pluralistic perspective on counselling and counselling psychology.
Okay, thanks for that, Mick. So we're going to be talking a little bit today about this topic of pluralism, this particular perspective that you've developed, and of course where we can find out a lot about this at the moment is through your very well received book on pluralism.
Okay.
What motivated you to develop this particular view of integration, Mick?
Well, actually, I mean, I didn't really come from an integrative background. I was always very much from a kind of more purist background, and I trained firstly at person-centered, then existential, and then taught in person-centered colleges. And I believe very passionately in the humanistic values underlying person-centered and existential approaches about a kind of deep trust, respect, valuing of clients, kind of engaging with clients in a humanizing way, not holding an expert position. And I think where I came to, and to some extent with John, was just feeling that paradoxically in a lot of person-centered existential circles that the client was trusted to the point at which they agreed with your way of doing things. But if the client wanted to do things in a different way, say like in a more directive way, or if a client wanted advice or a client wanted guidance, then there was a tendency to kind of want to pull them back into the way that it was being, the person-centered or the existential. So rather than actually valuing that there is a diversity across clients and clients will want different things at different points in times, I think paradoxically some of these humanistic approaches ended up becoming quite dogmatic or doctrinarian about how therapy works, what clients want, that clients want a non-directive approach, or that clients need to face certain existential givens, which seems to go against the kind of humanistic basis of a lot of these therapies. So I think pluralistic approach for me, and I think for John, was about trying to extend these humanistic values, but onto what I'd call a meta-therapeutic level, thinking about therapy as a whole, valuing that clients can want loads and loads of different things, and we don't have to be prescriptive about that, and also valuing all the different things that different therapists can offer. In the person-centered world, we talk a lot about unconditional and positive regard, but sometimes it felt like when it came to CBT therapists or psychodynamic therapists, actually there was a lot of judgment and criticism and devaluing. So pluralism is about trying to value the different work of different therapists and the different things that clients want.
Okay, great. Thanks for that, Mick. You've said quite a bit, I think, about what pluralism might be, or certainly the ethos behind it and the motivation. I've got a little challenge for you now, since we've got quite limited time in this dialogue, to see if you can describe the essentials of pluralism in 1 minute, and I'll time the minute and let you know when it's up. So, are you ready?
I'm ready.
Off you go.
Okay, so we have two basic principles of a pluralistic approach. One of which is that there's lots of different ways that clients can be helped in therapy. And the second of which is that if we want to know the best way of helping a client in therapy, we should talk to them about it. That's less than a minute, wasn't it, Tony?
That was very well done, Mick. Yes, that's about 20 seconds in actual fact. So, yeah.
That's how simple it is.
Good.
Do you want me to expand on that?
Yes, if you'd like to, yeah.
Okay. So the first principle is around that, rather than arguing about is it better to do CBT or person-centered or psychodynamic, that actually different clients need different things at different points in time, and we should try and be open to that. And as far as we know from the evidence, or at least until the evidence suggests otherwise, it seems like there's loads of different things that can be helpful for clients to change. Of course, we can't know how to do everything, but it doesn't mean we can't respect and value the different approaches, learn about what we can, refer on if we don't think that we can particularly help somebody, and be valuing of the different approaches. So that's the first principle. And then the second principle is that if we want to know how to work with a client, let's talk to them about it. Doesn't mean that we should do whatever they say. Doesn't mean if a client says they want advice, we just give it to them. But it does mean involving the client in that process of finding out for them what's going to be most helpful for them, because different people, again, seem to benefit from different things. And, we've got some knowledge and understanding of that, clients have some, and the best way forward on that is generally to talk to them.
Okay, that's very helpful. Gives us a good overview. I've seen it said, I can't remember where, but I was reading something recently, it may have been online, and somebody said, it probably wasn't you or John, that pluralism is a humanistic technique. Do you agree with that? Do you have to be humanistic to use pluralism?
It's not. Well, I think firstly, it's not. I wouldn't call it a technique. I mean, I tend to like talking about pluralistic framework actually, and it's a kind of a philosophy or a sensibility. It's a way of thinking about therapy as a whole. And as I was saying, it's an approach which is about valuing the different clients' perspectives and the different perspectives amongst therapists, and valuing diversity, valuing difference, not trying to homogenise things. I mean, I guess I would see that as a fairly humanistic perspective. I think humanism is about, not as a practice, I'm not talking about kind of specific person-centered or Gestalt practice or existential practice, but I think for me, humanism, as we might understand it, for instance, underpinning counselling psychology, is a philosophy of valuing individuality, difference, diversity, respect for clients. It underpins everything that we do, and that's the core of the pluralistic approach. But I think in that, we're talking about humanistic philosophy, not a humanistic practice. So it's not saying, and I'm sure there's enormous numbers of CBT practitioners who hold that, psychodynamic practitioners from all the different perspectives would hold that basic view that deep, therapy needs to be done in a way that deeply respects clients and respects and values their diversity and the differences across them.
Yeah. Okay, just following that up, how different perspectives might look at this. I mean, I guess people from a variety of perspectives might question part of the pluralistic framework, which is the notion of working with clients to define goals very quickly. And people might wonder to what extent clients are capable of defining goals that quickly, and whether there's the real core issue they bring, are they fully aware of it? Are they able to verbalise it?
Yeah, I mean, it's a really good question. There's a number of things there. I think one is that when we first articulated it in terms of goals, a lot of people don't like the term goals, and it's quite, it's a bit mechanistic, I think, and it's probably not the best term. I think what we were trying to articulate there when we wrote in the book you showed about therapy being about goals, what we were trying to say is, let's start with what clients want from therapy and orientate the therapeutic work around what clients want to get out of it. But when we say that, when we say what clients want to get out of it, we don't mean the first thing necessarily the client says, because obviously, as you say, clients may not be aware of what they want and what they need may not be the same things. So when we talk about client wants, client goals, we're talking about at the kind of most deep level, and that might be a kind of need for a relationship or a desire to kind of actualize themselves or a desire to feel more competent in their lives. But it may not be something that they can immediately access or talk about. So the process of working towards client goals isn't one thing. It's not about saying to a client at the beginning of therapy, right, what you want, and sticking to that. It's about opening up a dialogue with clients, talking to them about where they want to be in their life, talking with them about how they would like to get there, and working together to help articulate that, help look at how we can do that, different methods that we could help them to do that. But it's really an ongoing process, and it's in many ways kind of identifying the goal is less important, I think, than being open and having a collaborative relationship with clients in which that dialogue takes place and that unfolding. Because kind of knowing what our goals are, sometimes the whole therapy really is about knowing what it is that we want in life and how we're going to get there. So it's not a one-off thing, but it's about helping clients feel that what they want is important, which I think is very much part of a humanistic ethos. But I think having said that, my experience of working pluralistically is that clients are actually pretty good at expressing what they want. Clients say things like they want better relationships, that they want to feel better about themselves, that they want to understand, they want to have a job that they're happy with. And in my experience, we use a goal assessment form when we ask clients what their goals are. I don't think I've ever talked to a client who said, I don't know what my goals are, or where the kind of goals have radically changed from the beginning of end of therapy. And I think that's part of the pluralistic ethos is about trusting and valuing clients and clients' understandings. And I think there's something a little bit underestimating of clients to think that they don't know what they want.
Okay.
Or at least I wouldn't want to assume they don't know what they want until I've had that conversation with them. It might be that I meet a client that says, I really don't know what I want. But then I would explore that with them. And then, okay, so what's brought you to therapy? And if they still say, well, I don't know what I want, I'd keep on exploring that with them.
Sure.
Part of it, Tony, is that it's very difficult, I think, to do therapy with somebody if you don't actually know what they want to get out of it. Because it may be that therapy isn't actually what they want or what's going to be helpful for them. If somebody, wants to be happy permanently in their life, and that's what they want, then, I'd want to have that conversation with them, because I'm not sure that therapy would get them there. I'm not sure what would get them there, but I don't think therapy necessarily would be the best thing. And part of talking about goals is so that we kind of know when we can and when we can't help clients, and not having the kind of hubris to think that we can just do everything for everyone all of the time. It's important to have that dialogue, I think. So it's about being aware of our limitations. Yeah,
absolutely. If I was a therapist out there, Mick, that was, I've practiced for many years in a particular way, pluralism's a fairly recent innovation. What are the strengths of it, you think, that might persuade me to want to move towards this position?
I think it's a very open framework. It's an open framework which allows for a lot of room, dialogue, collaboration, negotiation, both kind of internally and kind of with clients. It's a framework which says actually there's so much about therapy that seems to be helpful, but there's so much we don't know. Rather than being stuck in one particular doctrine or dogma about how it works, let's try and be really open to a kind of multiplicity of change processes. And let's explore that with clients and find out what's helpful for them. And I don't think it's a position that suits everybody. I think some of us like more coming from that position of unknowing than others. I know for myself that I find it a very rewarding way of working, because it's kind of open. I'm not trying to prove a point. I'm learning and discovering all the time, and I'm finding out about things. And I think particularly the thing about talking to clients, we did some research recently about asking therapists to do a form about, kind of measuring how much they subscribe to pluralistic perspective. And then we asked them also how satisfied they were with their work, and we looked at the correlation. And what we found is actually the more pluralistic they were, the more satisfied they were with the work that they were doing. But the really interesting bit was that the bit that particularly correlated with satisfaction was the extent to which they were discussing and negotiating with clients about what to do in therapy. And I think that's my experience as well. There's something really rewarding about having a kind of collaborative relationship with a client where you're really saying to them, what should we do here? How would you like to work on this? And then trying things out. If it does work, if it doesn't work. trying something different. I mean, it's a bit like, you have behavioural experimentation, and I think, when people have used that, when I've kind of gone towards that, there's a kind of lightness, I think. There's an openness, and I find that a really rewarding way of working.
Okay. One last question for you then, Mick, and this is about different approaches to integration. I've been reading recently a book by a French author. I don't know if you can see the cover of this book.
I can see it. I'm not sure I can read it. Espaces de représentation.
It's about representation as a psychological view, schemas, representation, and how you can use that notion to capture other theoretical views. So it talks a lot about the psychodynamic view, and how that is something that gets represented in a cognitive way, which obviously that kind of way of looking at things is quite different to pluralism. Do you think there are advantages to the pluralistic way of looking at integration compared to other ways that people have thought about integration?
I think that, there's lots of different ways. There's theoretical integration, there's assimilative integration, and a pluralistic perspective is not kind of saying this is a better way of doing it. I think, the pluralistic approach is always about trying to stay open and trying to be inclusive. And, if somebody wants to work in a kind of theoretically integrative way, or theoretical integrative assumptions, that's great. But I think what a pluralistic framework always does is it always kind of adds that otherness. It always adds that kind of question mark at the end of it, and it always invites us not to get too caught up in any particular kind of belief or assumption about how things are. So, you can take these different therapies, you can take cognitive behavior therapy and psychodynamic, and you say, okay, there are these core principles. And certainly that would fit within a pluralistic framework. But a pluralistic framework would also say, let's just be a little bit careful about assuming that everybody is going to live and be helped by these principles. There's always space for difference. There may always be, people who don't fit in. And one of the questions we get asked a lot is, what is the difference between a pluralistic approach and a integrative approach? And I think, part of it is that in pluralism, there is that there is that kind of openness just to not ever kind of come into a complete answer, holding open the question marks, holding open the uncertainty. And also, I think, compared with the theoretical integration, within pluralism, there's always that collaboration with the clients, which is often there in theoretical integration, but is not by kind of definition. And that's one of the key things about pluralistic approach. So I think those things can be really useful and can really come in. But I would see them kind of functioning best in a way as under a kind of pluralistic umbrella, which also allows for other possibilities, and other ways of working and other ways of looking at therapy.
Okay. Well, I'd like to thank you for that, Mick. Thanks for giving us time and taking us through some of your thinking around pluralism. Thanks very much.
Thanks, Tony.